Hi there, welcome to another installment on My Ultrasound Diaries. So, I had a 9-year-old girl present with a lower abdominal swelling, specifically in the right lower quadrant. On examination, this swelling was pretty smooth, it was medium in consistency, not mobile, not tethered to the overlying skin. That is, I could separate the skin from the mass. However, it was attached to the underlying muscle. What I found with the ultrasound, where this swelling was located, was this heterogeneous mass located at the anteromedial edge of the external oblique muscle. It didn't have any extensions into the internal oblique or transversus abdominis, as you can see from this image here. This mixed echogenic mass measured about 21 millimeter by 10 millimeter in two dimensions with a transverse section. So we can see the mass again here, mixed echogenic heterogeneous with poorly defined margins, and then we can see some interaction on color Doppler around the mass's periphery, indicating vascularity. Now, this could be a feeding vessel to the mass or a branch for the external oblique closely associated with it. And here is my report. A poorly defined, irregular, heterogeneous, mixed echogenic mass with a largely anechoic center is visualized within the anteromedial edge of the external oblique muscle at the right lower quadrant. The mass measures 21 by 10 mm in two dimensions and interacts with color Doppler at its periphery. And my impression is an anterior abdominal wall mass, query nature. Keep in view intramuscular hematoma. Now, because of the wide range of possibilities this mass could be, I didn't fail to leave out some differentials, which would include abscess, desmoid tumor, fat necrosis, or more sinister lesions like sarcomas. Now, the ultrasound is not definitive diagnosis to some case scenarios like this, so it's important that you suggest other imaging modalities like the CT, MRI, or even a histology to have a definitive finding on what this could be. But if this is your report of the mass with the ultrasound, you've done a good job.
Stay tuned for more content on my ultrasound diaries. Cheers.
Stay tuned.